installment of the Black and Latina Maternal Health Crisis, brought to you by Black Millennials for Flint. We also wanted to take a moment to appreciate our community partners who allowed today to be possible. One of our community partners is Moms Clean Air Force. We also have Corazon Latino, and we have Black Breastfeeding Week, which is every year from August 25th to August 31st. So today we are on day one of this observation, very important public health observation. And so we really wanted to take a moment to thank them for being our community partners, also being our community partners last month, and to take a moment to just observe how important having a Black Breastfeeding Week is, especially with everything going on with Black maternal health and Black infant health. So without further ado, I would like my panelists this evening to introduce themselves, tell us a little bit about their work, share any announcements or upcoming events that you'd like the community to know about, and of course, share your gender pronouns. So without further ado, I will allow whoever wants to go first.
I can start off. Thank you, Vanessa. Hi, everyone. It's such an honor to be with you all today. Part one was so exciting. There I was mentally flipping diversity and equity and inclusion tables and had to come back to continue part two. My name is Cynthia Gutierrez. My pronouns are she, her, and ella. I am currently in the lonely land of Oakland, California, and particularly East Oakland, California. And I am the current program manager. I know that the advertisement says for UCSF Bixby. UCSF is the University of California, San Francisco. But in particular, I am the program manager for two programs. One is called Team Lily and one is called Hive. And when I'm not at work, I'm a doula, I'm a storyteller, a cultural strategist, and have been doing different community work around the intersection of reproductive justice, the criminal justice sector, and health issues for a while now. I'm really excited to be here.
Thank you so much. And on to our second panelist.
Hi, everyone. Again, thank you so much for the invitation to be a part of this discussion. Happy Black Breastfeeding / Chest Feeding Week to all of those who are watching and tuning in. My name is Rodney, and I'm the Executive Director and founder of MOMCares. MOMCares is a doula support program that is geared towards providing birth support to Black women with navigating a high-risk pregnancy, as well as postpartum support to women who have had a negative outcome. My pronouns are she and her, and I will say, make an announcement now that we are getting ready to launch our NICU training, volunteer training, that starts off, that will be launching September 25th and 26th next month in observation of NICU Awareness Month. I'm really excited to be here and ready to see.
I'm so excited to hear about NICU. Oh, I didn't even know that existed. So I'm gonna be so excited to get that information out to everybody as well. Thank you so much. Third, we have Sasha.
Hi, everyone. My name is Aleksandra George. I also go by Sasha. I use she, her, and aja pronouns. And I'm currently an environmental attorney and litigator at the Environmental Protection Agency, which is a federal government agency. Previously, I had worked at Earth Justice as also an environmental litigator. It's a large and very problematic NGO, predominantly white. I'm in the Boston area currently, and I've been involved with some local matters pushing forward. And while I was in DC, I was lucky enough to be a part of the ambassador program that Black Millennial for Flint hosts. I'm very proudly an alum of that. and happy to be back here today and see all of your beautiful faces. Thank you for agreeing to be coming back.
Thank you again for returning. It's always great to have that policy legal side of things, because I think a lot of times that perspective isn't always, you know, in the center of these conversations. I wanted to make a plug before I do my introduction that our third cohort of Black Millennials for Flint lead ambassador applications are out. So for those of you, whether you found out about this on the newsletter, Instagram, Twitter, Facebook, however you found out, word of mouth, me on somebody's listserv, follow us on social media so that you can find the application and apply if you are in the cities that are part of our network, or if you want to encourage us to add another city to our network. Because as you know, environmental injustice is impacting every city across this great nation. If there are Black and brown folks, chances are there is some issue that needs to be addressed, and we would love to partner or partner in moving those type of, you know, the progress that we need for those issues to move them forward. I specifically say partner because I don't want to say lead the way. No, there's always already grassroots work happening that just needs to be centered. So I am Vanessa Vassall. You guys know who I am, but I'm originally from Seattle, Washington, South End all day. I'm currently in the DC area, where I am a maternal health epidemiologist for the federal government. Anything I say today here, however, is my own opinion and is not representative of the federal government. I'm also a full spectrum doula and health educator. And most importantly, I am a member of the second cohort of Black Millennials for Flint led exposure prevention ambassadors. So my pronouns are she, her, ella. I don't speak Spanish, but y'all can ella me as well. And let's just go ahead and get started, you guys, because I'm really excited about today's conversation. Even though our panelists have been provided with some questions, just like last time, I highly encourage this to be a very organic conversation. Please just speak whatever is first on your mind and at the top of your heart. We really want this conversation to be, organic. So I'll start with our first guiding question and we'll go from there. So as Bell Hooks famously said, being oppressed means the absence of choices. Black and brown parents are left with few opportunities to make informed and autonomous choices around breastfeeding or not breastfeeding due to misinformation, a lack of accessible lactation support, and mistreatment in the United States healthcare system. I'm coming through hard already, you guys. Consequently, Black and brown parents are then blamed for their own poor health outcomes. This is the phenomenon that Dr. Monica McLemore highlights as mother blame. So in your work, panelists, how do you see the absence of choice impacting Black and brown communities as it pertains to breastfeeding and chest feeding and other aspects of the postpartum period? And actually, I'd like to pause and allow you all to reflect. And while you all are reflecting, I'm so excited. I'm gonna give her a second to breathe, but I'm actually very excited that our next panelist popped up. I hope I'm not putting her on the spot, but when she has a second to breathe, I would like Aza to introduce herself before we jump into this first question so that you all have an idea of who is rounding out our circle of voices this evening. So Aza, if you have a moment to go off mute, I'm so happy you were able to make it, and tell the community a little bit about who you are, what you do, and if you have any announcements or upcoming events.
Oh, you're on mute.
Thank you. My name is Nedhari. I am a licensed certified professional midwife. I am also the executive director of Mamatoto Village, located in Washington, D.C.
Thank you so much, Aza. And I'm so honored that I'm training with Aza as a part of the perinatal health worker training. So if anyone is ever interested in learning more about where birth work intersects with community health work, check out Mamatoto Village website. So anyway, back to our first question, whoever wants to get started.
I can start. So as far as the absence of choice, what I have observed as doula and birth support is that choice is a construct. Like we see that, oh, we might have a choice, and it can show and look like we actually have options, but in the dissemination of information, the absence of information that is given out, the information that is highlighted dependent on your race and apparent socioeconomic background, it really takes the choice out of it. And then also on top of that, when you have, I'm also a consultant for the Baltimore City Health Department around perinatal mood disorders. And we've been having conversations around when there is something to choose or to opt in or opt out of, when a parent makes that decision, the entire onus is put on that parent. And so that can be completely overwhelming without the right information, without the right support to access the entitlements that are being offered or laid on the table. And so that affects our families because, you know, if I have a new baby, if I am struggling with breastfeeding or perinatal mood disorder, having something else dumped on my plate is not going to make me want to run towards that option, especially if it is absent of compassion and care when that information is given, especially if I feel targeted by the type of information that is given and the timing of that information. And so if I don't feel safe into a doctor's appointment as a Black woman and feel like I'm going to be singled out and only given this amount of information or this access to resources and services, but be ignored completely for screenings and other things that could be supportive of me and my birth journey, I'm going to completely disengage. And that leaves our families at risk. And that also goes into that blaming, like, why didn't I do this? Why didn't you follow up? Why didn't you make this appointment? Why didn't you go? And so, especially in a town like Baltimore City, if I have multiple children, I have a failing infrastructure, I have, transportation system that is abysmal at best, and I'm expected to go across town and zigzag across town to get multiple services and resources that each of them, when I get to that office exhausted and tired and overwhelmed, I'm treated like less than a human. I'm going to stay my booty in the house because I know how to take care of myself. I know how to respect myself. And in a space where when I am extremely vulnerable and extremely sensitive, I would rather stay isolated and make sure that my space is clear and I feel as safe as possible. But that again puts us at risk, health risk of mental health issues, not knowing that we're not by ourselves. It's very easy. One of the things that we see with our healing circles that we do with families is people think that they're going through this completely alone. And if they just have a community to say, hey, this is happening to me too, that completely cuts the risk in half, if not more, as far as being able to feel safe reaching out for help or accepting resources. But again, we don't have that luxury because of the way we're treated when resources are given or presented to us, or the absence of resources altogether. And the fact that we wear it on our skin, and implicit bias makes it clear that we cannot be ourselves and still expect the same level of service and compassion. Is really sad and stressful. But I'm going to get off my soapbox and let someone else speak.
I appreciate your soapbox. Who wants to make a remark next? Thank you.
I can make a quick remark. Thank you so much, Anna, for what you said. For myself, working in a large healthcare institution as a program manager, and also working as a doula in other local hospitals and entities, one of the things that I'm always very vocal about is that the absence of choice that I've observed starts with the implicit bias that everyone from the nurses to the doctors to the healthcare workers to as soon as you walk into a hospital, the security guards, like, I mean, this starts at like every level of racism and implicit bias. And so it's hard to encourage someone who identifies as Black or brown to go into these institutions when these institutions were never made for us. They're not made to be safe. They're not made to be comforting. They're very cold in appearance and in the ways in which that people interact. One of the things that I find so unfortunate is that our healthcare system, and particularly the institution that I work for, which is the local county hospital in San Francisco, we have never built an infrastructure for postpartum or breastfeeding support. It's not like when the Department of OBGYN, they're like, okay, we're gonna specifically have, you know, one program to serve all pregnant folks and make sure they get this care. I mean, of course, like when someone delivers, you have that that interaction with like a nurse and they, you know, try to show you how to breastfeed, and you have your handful of postpartum visits, but it's not like insurance companies are supporting continual support in the postpartum. And so this makes me think of a lot of the folks that I know don't necessarily rely on these institutions to support them. It requires people to make community with folks like outside of the institutions. It requires people to have chosen family or just family in general that can hold that space, because these systems are not built to hold people in that way.
I'll just very quickly add on that. Everything that Anna and Cynthia just said is extremely, extremely important. And the legal system that this country has supposedly laid out isn't, I think, exacerbates the problem. And just to, I think what Cynthia and Anna was saying about these systems not being accessible to everyone and there being a bias embedded in it, the way the legal system is set up, there's an assumption that folks will have access to that legal system and the knowledge and the trust. And there is very good reason that Black and brown communities in this country and also in other countries that are now immigrating here don't trust this specific legal system because of how it is founded in white supremacy, and a lot of the actual statutes and the court judges that have upheld these statutes, including in some federal courts in the past, also have very explicitly upheld white supremacy and the belief that these systems are here to protect whiteness, not necessarily every single individual in society, especially including the most vulnerable individuals, which I would argue are Black and brown women, non-binary, and trans folks.
Thank you, Sasha. Azza, did you want to add something, please?
Yeah, I think I just wanted to add, you know, thinking about how this lack of choice really strips agency and strips autonomy, and really diminishes the capacity of an individual to be self-determined. I think much to what Anna raised, that choice is often presented as an illusion in a system that inherently blames Black and Indigenous people of color for their own outcomes, right? And even when we think about in our reproductive health system, people largely still don't have the choice to determine the gender that they want to be represented as, right? And to have care providers inside of that system that validate who they are, as opposed to marginalizing them or trying to fit them into this perfect box of gender, right? And then also just thinking about, again, largely you asked about how this is impacting us on a community level. from what I observe is that, you know, this lack of choice or this illusion of choice really is harming like Black and Indigenous people of color, and making it really difficult for people to parent and give birth and to raise children in a way that is best for them, and best along their own interest.
Thank you for your comments. I wanted to, before we move on, I wanted to kind of talk a little bit about choice in the sense of also choice to and not to breastfeed, because I know it's a tough conversation to have during Black Breastfeeding Week to say a woman can choose not to, and what does that look like, right? We promote it as, you know, a very important public health intervention, but we also have to empower women who say, that's not for me right now, and they have the reasons, and that's okay. Can anyone talk a little bit about that tough place to be in if you're supporting a mother, or a birthing person, or a parent, a new parent? I'm still working on it, you guys. A new parent on who's making that decision, and we want to encourage that new parent to make a certain decision, but it's also not our job because we're not the parent, right? Does anyone talk about that?
So Vanessa, you and I kind of spoke about this on our initial phone call. And so with the population that I work with, families in the NICU, where there are multiple things impacting the birth and postpartum experience, oftentimes families who are struggling and trying their hardest and their damnedest to be able to do that for their child. And in those moments that I've had to be of support for families that ultimately have decided to stop for medical reasons, just, you know, exhaustion and timing and just their own mental health, there is this feeling of, I have failed, I am not good enough, I am not a good parent, my body has failed. And so these parents are already dealing with and processing an apparent failure because they're in the NICU. So they're already dealing with those feelings around something went wrong, I didn't have what I needed, I didn't do the right thing, what is wrong with me? And then on top of that, it's compounded with, this is something that I can throw myself into. And I've seen parents, and I myself have been one, who has absolutely thrown themselves into the idea of breastfeeding and getting that milk to their child. And to little or no avail. My son was in the NICU for 6 months. For the first 2.5 months, through 3 different morbidities of my own, I was trying to breastfeed. And this is multiple different surgeries, blood clots, medications, antibiotics, things that could negatively affect my child if ingested through milk. And then exhaustion and PTSD and all of these other things that are compounded on top of. And still, when my son came home 6 months later and we were in the community, people are like, oh, are you breastfeeding? Oh, you're not? Oh. And that is completely isolating and not fair to families that had to make a choice for themselves. And so we're talking about NICU work, but really that choice is across the board. You know, I completely, you know, the evidence is there around breastfeeding and why it has been deemed is best and why we should be encouraging it. But again, as doulas, at least, our job in the birth and parenting process is not to put our own politics and our own understanding on someone else's decisions and choices. It is to educate and support. So I educate you on the pros and cons of breastfeeding and not breastfeeding, and then I support your decision whether you do it or not. And that is our role, our politics, our choices, our beliefs do not belong in the birthing room or in the midst of our families. Our job is to educate and support.
Absolutely, thank you for that. Cynthia, you wanted to add something?
Yeah, some of the families that I work with are families who are living with HIV. So there's already a tremendous layer of guilt and shame when it comes to folks that identify as a woman trying to get pregnant, living with HIV, and then what happens once my baby is born. Like, there's so much to hold there. And so one thing that our program has done well is they've established a really good working relationship with a Bay Area milk bank. And so what does that mean to say, like, look, there's going to be a lot of stigma, there's going to be a lot of guilt once your baby is earthside, and here are the options for you. Like, whatever you decide, here's all the evidence-based information, here's, you know, doctors' recommendations, but like, you have options. And I think it goes back to that question you had around choice. Like, if someone doesn't even know that they're like, I didn't even know there was like a milk bank before I started working with them. And, you know, like, I wouldn't, like, that wasn't where my attention was. But like, if we don't even provide those basic resources, something that seems basic to us could be life-changing for someone else, because it's like, and for other families that I work with that aren't living with HIV, you know, we give that information as well. And really talking about it as if this is information that is shared with everyone. It's not information to like make you feel excluded or make you feel like something is wrong with you. It's, we want to make sure that we're equitable with the knowledge and resources that are out there. So I think that is important when it comes to this concept of choice as well.
Could I also add the idea of the fact that there are happy mediums out there as well as far as breastfeeding? And so, you know, Cynthia was talking about the milk banks. And there are also things where if the milk bank is not a feasible option for you, or you don't want to go towards that, there are things called this, like the supplemental nursing system, where the baby will still get formula, but you can still bring the baby to breast, and you can still get bonding benefits, you can still get a number of different benefits, and even possibly increase a supply while making sure that you have that peace of mind to support your baby's nutritional needs. And so I think understanding that it doesn't have to be black and white, and that there is no right choice. Even within the birthing community, there are choices that might have better outcomes, that are evidence-based to have again better outcomes, but there is no right or wrong choice. And understanding that all of the mothers that I have come in contact with, all of the parents that I've come in contact with, their choices are informed by their desire to be the best parent and show up as the best parent. And so supporting those choices with best intentions at the forefront.
Do y'all mind sharing what a milk bank is and what they do and what's there when you get there, and just for anyone who isn't familiar with that service or may not have it in their community?
I just want to add that I put the link on the comments for the milk bank that we use here in the Bay Area. But the great thing about this particular one is that because we had been working with them for so long, it makes the like the transportation of the milk easier. So if you all go on this website and just, you know, break it down at the most basic level, there are people in the community that are more than happy to donate any extra milk that they might have to this particular organization. And they go through a process of like filtering the milk, you know, making sure that it's healthy and something that can be shared. And organizations or individuals can like connect with them and getting that resource. But one thing that I really particularly enjoy about this organization, and possibly others, you might know of others nationwide, is that there's information on different breast pumps, on different supplies. So it's not just like you come get your milk and you peace out. It's like they give you information on local resources that go beyond just the milk.
So I see that in the chat, someone asked how environmental racism impacts breastfeeding options, which is a very big question, but it's important to tie into this conversation. I think that a lot of what Cynthia and Anna are talking about are the real-time, day-to-day conversations, concerns, and impacts that folks parenting or considering to parent or trying to parent are having to live through. And then there's this whole realm of contact between those individuals and the environments they live in, and also the emotional environment they're having to survive in before these decisions and conversations happen, and then the very little access to remedies after a lot of the impact occurs. And I would say that for folks who are women, femmes, non-binary and trans, who are pregnant, trying to become pregnant, breastfeeding or considering breastfeeding, there is a lot of racial trauma in and of itself that is impacting their bodies. And there's also, I think Latricia mentioned this in the comments in relation to mothers and parents in Flint, there are heavy metals and toxins in the environment that their body is coming into contact with, which all over the world, Black and brown folks are disproportionately exposed to. And what this means is that in so many facets and from so many levels of exposure, their bodies are being forced to, I mean, I'm not an expert, I'm not a scientist, so bear with me, but basically their bodies are being forced to process all of these toxins, including toxins produced by their bodies due to racial trauma. And then there are all of these decisions and conversations and considerations that are happening in between. And then once some worst case scenarios happen, I would argue that they're stuck in a system that isn't designed to capture them or to support them. So there isn't, for example, one single environmental or public health statute that addresses the cumulative impact that racial trauma has, in addition to like an individual being exposed to toxins, including lead and other heavy metals. And the very few environmental statutes that we have, like the Toxic Substances Control Act, TSCA, and there's also like a lead statute, do very little compared to what some other portions of the world have started to address. Like, I won't go too much into detail, though if folks are interested in going to more detail, I'm happy to, but TSCA, for example, the Toxic Substances and Control Act, only has a few hundred chemicals listed, and most of which have been listed for over 30 years, and that hasn't changed. And this is in comparison to that tens of thousands of chemicals being listed in the European equivalent. And this is one of the main federal statutes and one of the only statutes that's regulating what chemicals are placed on consumer products and come into contact with these folks trying to parent or parenting. So it's just, I don't know, I'm listening to all of y'all and then also reflecting on how incompatible these needs are with the justice system that we're claiming this country provides for everyone. Not necessarily we, I'm not saying that we in this panel are claiming that. I'm saying that this country claims is available to everyone.
Thank you, Sasha. Aza, I think I saw you go off mute.
Yeah, I was going to just go back to that point around the intersections of environmental aspects in breastfeeding, is also thinking, like also layering in those social influence determinants and thinking about Anna's going back to that illusion of choice, you know, and layering in those other aspects of food insecurity and homelessness or housing insecurity and environmental degradation and environmental safety. And and I seen somebody mention Flint, where you're dealing with clean water. And so when you layer in those aspects, as well as the historical legacy, especially around Black people with breastfeeding, because that part has to be included in that conversation. You know, this reason why somebody chooses or chooses not to breastfeed is, to me, it's very layered. And is compounded by so many different factors. It's also compounded by the over-sexualization of Black bodies, and the way in which Black bodies are commodified. It's also in those dynamics. It's rooted in our family legacies around breastfeeding, and whether or not our moms or our grandmothers breastfed, and if that was a family norm or custom. And so I think that that support in someone's decision is not, to me, from a place of judgment, you know, but more so from a place of curiosity, and also just not understanding, you know, fully. We never know people's stories, right? And just not pushing our own perceptions or our own desires, whether they were actualized or not, onto another person. Because to me, at the end of the day, what we're talking about is whether or not we truly are operating from a reproductive justice framework, right? And operating from that framework will allow us to support a person however they show up in whatever choice that they are making as it pertains to their body, and how they're choosing to parent the children that they have.
I'm so glad that you mentioned the over-sexualization of Black bodies, because I feel like that is such an important conversation to be had in the same conversation as breastfeeding. I was at a dissertation proposal defense that a young Black scholar was doing, and she was presenting a focus group. And she talked about one of the young ladies saying that she didn't want to breastfeed her son because it was too triggering of a sexual assault that she had had when she was younger. And the idea of a male demanding her body on, like, you know, on demand, even though it was breastfeeding, it was still re-traumatizing from another experience that aligns with a male demanding a part of her body on demand. And when she said it like that, I was like, I hadn't, you know, thought of the parallels, and I really would understand why that's not something that you can just blanket say, well, everyone can do this, or no, if someone has that type of traumatic experience, that has to be taken into consideration when it comes to what's best for that parent. And yeah, so anyway, I didn't want to get too off course, but let's switch. Yes, is somebody?
I do
Go
want to
ahead.
mention quickly before I forgot that Mother's Milk, they have locations in California, but they are also they are largely based in Texas and in much of the Southeast. And there is actually a location in DC, not far down the road from me. And if you look at the website, a lot of their resources are connected and linked to WIC locations, which is another thing, but
That's
they
a whole nother thing.
There are. Yeah, no, I'm just repeating myself because that's what I do.
I also, before we like pivot topics, I know Kimberly Aller-Sears, who's just this amazing, like, fearless Black woman, but in her book, The Big Letdown, and just in other presentations that she's done, I think is also important in this, especially in this infant feeding conversation and breastfeeding conversation, to lift up the fact that formula companies over promote in Black communities, right? And in Latinx communities. And so if you have, again, thinking about this quote unquote choice, you know, like, is it really choice? Or are we talking about somebody who has overly been suggested to do, to make what they believe is a choice, But what we have is I've pushed something on you so much and I've made this an established norm that the conversation shifts to, well, formula feeding is just as good as breastfeeding, right? And it's not to put hierarchies, right? Just from a purely scientific point, breastfeeding, breast milk is superior, not necessarily breastfeeding. But I think that also has to be a part of the conversations that Black people and people of color are not supported in the same way. There's not the same access to resources, not the same access to lactation consultants. The fact that there are so few Black lactation consultants, I don't know how many Latinx, but I'm assuming that Indigenous, if we go to Native folks as well, that those numbers are very small. And so if you don't see yourself being reflected across the cultural spectrum, then are you really making a choice out of information? Or is it that you're making a decision out of a lack of, right? And that could be a lack of knowledge, a lack of access, a lack of awareness. So it's just, I think those other aspects have to be brought forward as well.
Yeah, we've talked about an illusion of choice. There's also an illusion of safety and an illusion of justice, which is just not present for us. So, what are the options left and most of us are fairly aware because of how much has happened in our communities that we don't have access to the same kind of justice that cis white women do. And we don't have access to the same kind of safety either. And that also goes back to the sexualization of our bodies and how, whether it be in our own homes, in our own communities, in predominantly white spaces, or in the multiple spaces we might be working in or not working in, or having to navigate to go grocery shopping, any of those locations. There's something there about that's pretty sad to think about, but also very real.
I'm glad you mentioned the illusion of justice, because this little pocket change that is supposed to be justice for the families in Flint, I find laughable. So if anyone is not paying attention to the news, I'll let you guys Google it yourself. But when you have a community that has been poisoned by lead for over 6.5 years to this day, poisoned, still got to pay their water bill, still got to pay their taxes, but are being poisoned. When you have the situation that we're dealing with right now, with parents making a really challenging decision about whether or not to send their kids to school, and you're talking about 6-year-olds, they've been lead poisoned their whole lives, 5-year-olds who've been lead poisoned their whole lives. I don't know how old kindergarten does it go down to 4 years old? 4 years old been lead poisoned their whole life. You want to give them was it $6,000 a parent? But anyway, let me stay on script, because that whole situation is frustrating me. I'm gonna ask this last little question. Yes, go ahead, please.
I would, so as we're having this conversation, I would like to point out that the systems that we are forced to operate in were set up for us to fail. And so, as surprising as we want it to be, that our options are not there and our support is not there, and we're being given information that is misinformation. We are being led to things that are less than superior for our bodies. We have to understand and recognize and say plainly that the institutions of this country were not set up for people of color. They were set up to make sure that people of color stayed and remained within a caste system that kept us under control and feeling and operating in a less than place. So, and please forgive me if I am misspeaking, but the city planners that went into Flint and created that infrastructure and created that piping that was flowing through communities, they more than likely knew what they were doing. And because those were Black families and brown families and indigenous families that were living in those areas, that didn't matter. So we're seeing that on a larger basis. And I think that is where the conversation comes Aza was alluding to about not having Black lactation consultants, but even larger, not having hospital institutions that are Black led, not being on the board of organizations that are making choices for our Black and Brown families. And so you have things like white coats for Black lives, and that is great. But as someone who speaks to hospital institutions on a regular basis, those are not the people that make the decisions. Those are the people that do what they're told and roll out whatever policies are given to them. And, you know, again, my hat's off to nurses and doctors for being there, for being at least trying to be our line of defense, but often they are playing a role that they're not even aware of, and some of them are. And so making sure that we know that when we are having these conversations around access and choices and things, we need to be very, very clear that the choices and the access that has been denied to us has been on purpose, is on purpose. And in order for there to be actual systemic change, we need to start changing the faces and the people at these tables. And even if you're not for that, and you're more revolutionary for that, then we need to get together and create a hospital system. We need to get together and create a lactation group. We need to get together and figure out how we're creating community that is safe and inclusive and gives options and choices to our families, because you know, we've been here for 400, 500 years at this point. Our rescue is not coming from those who brought here for labor. Our rescue is coming from within. Again, I'm going to stop. I'm a little hyped.
I'm just going to feed off of your energy, and before I comment, say that nothing I've said in this panel or I'm about to say is reflective of the federal government or the US EPA. These are my personal opinions and thoughts that I'm sharing. I saw this beautiful Instagram meme the other day that said the revolution isn't gonna be like come from a 501c3. Like, it's not gonna have 501c3 status. And I would also say, in addition to all the things you labeled, we need new legislation, we need new statutes, we need community oversight that, you know, is independent of the corporate infrastructure and the federal and state enforcement infrastructure. And like, honestly, y'all, like the environmental statutes that some of these cases were brought under, and I'll like be very vague here, obviously because of where I work, like best case scenarios, these folks weren't gonna get their medical bills paid. That is not possible under these statutes. So even like, I don't know, it's just, I think that people don't really realize that the realm of the body of law that we have accessible to us would never currently be able to fully address all of the issues that these families are facing. So, I mean, we're like fighting in a system that, like you said, Anna, isn't meant to carry the burdens of the folks who are most being exposed and are, you know, dying in greater numbers. So
I also want to say that my views and feelings are those of my own solely and are not representative of my organization. They are my views.
You know, I always get super energized with Sasha, like since the first time we met, it's been on. And like something that I was thinking about when you were talking, Sasha, was we're in a global pandemic right now. I'm currently in East Oakland. The zip code that I am in right now, there was an article last week that proved there was an 81% increase in COVID cases in my zip code right now. And so as you know, we think about this global pandemic of COVID, my community is mostly Black and Latinx folks. And I don't know how familiar you all are with the environmental injustices and things that are happening in Northern California, but we currently have wildfires happening. Santa Cruz County, which is less than 70 miles away, the last 5 days have experienced extreme wildfires to the point where entire businesses, homes have been burnt to the ground in the Santa Cruz Mountains. And so that means that although I'm a little bit over 60 miles from there, and I used to live in Santa Cruz for 6 years and have been supporting people evacuating from there, the fires continue to extend towards the Bay Area. So that means we're getting toxic air in the Bay Area. So a pregnant woman, many that I know of today, are at home. Oh, and right before the fires, we had a heat wave that the Bay Area had never experienced. Some were saying that there were parts of California that went up to over 113 degrees, which this state, like, y'all has never seen. And so we're here, you know, I'm hearing pregnant women say, I have to decide whether I will open my window because it's hot, because I'm burning up in this home as a pregnant person. And then I can't open my window because the toxic air from a wildfire miles away, I can die, you know, have all that happen. Yeah, right here, Maya said 110 all week or last week. And then if I step out in my East Oakland community, there's a possibility that there's COVID out there. And so there's just so many like intersecting environmental like disparities that are happening on top of racism and white supremacy that like it really breaks my heart, and it makes me want to show up even harder for these birthing people because there's so much against them right now. There's so much. And so like, how can we continue as like Black and Brown folks that are passionate about this work, continue supporting people as like these disparities keep coming out one at a time?
I appreciate you sharing that, Cynthia. And prayers up to everybody in Cali because it's hot, it's on fire, and it seems like they're just leaving y'all out there to burn up. I mean, I don't want to get off topic, but you know, I do get a little worried about the response. Go ahead, Sasha.
And the farm workers, including folks who are probably pregnant and also working those farms so that the whole country can eat. Sorry, I just needed to also mention them.
Yes.
No, I'm really glad you mentioned that. When I was working in New Jersey, I was an intern at the health department in maternal child health. And one of my first little tasks was to make a perinatal health tips sheet for migrant workers in the area. First of all, I didn't know that there was migrant workers in New Jersey. Clearly I didn't know much about New Jersey. And then I was like, once again, to the whole mom blame, I'm like, so we're giving them a handout that, by the way, was in English. We're not talking about any of the policies in place for their employer that have to do with their safety. It was a whole thing. But Azza, did you want to say anything before we go into our Q&A?
No, it's okay.
Are you sure?
Mm-hmm.
Okay. So I want to thank everyone who's been engaged. The chat has been blowing up, and Latricia has been doing a great job monitoring and managing our questions. So because we have 7 minutes and we like to keep the last couple of minutes for a call to action, we are going to take as many questions as possible. And just like last time, any of the questions that we don't get to, we will address in a FAQs sheet that you guys can download. The one that was provided from last month, if there's anything that you all think needs to be changed, revised, or added, please let me know. And I will make those changes and add anything, specifically any resources that we can get out to our followers and listeners. So Latricia, I don't know if you're gonna pop in and be the whiz and read the first question, or if you'd like me to read the first question.
Yeah, so the two questions, hi everyone. The two questions that were asked really have been captured throughout the duration of the conversation. So the first question was, what are some programs we could look into to become trainers for doulas? And this attendee is located in Riverside, California.
So first of all, and I need to apologize. My mother in the honor of my mother, I have to correct everybody. People have been calling me Anna all night. My mother named me Anna. And it's a small change, but in her spirit, in her honor, I cannot move forward without making that correction. I usually let it slide, but it just hit me that she would
No,
be upset if
ma'am,
she was
never let
able
that
to.
slide.
So, so it's Anna, number one. And number two, I will say that I'm currently in a training program to be able to certify doulas through DTI, which is Doula Trainings International. I'm part of, that's Aiden. I'm part of their first cohort. But Doula Trainings International does have a focus on social justice around doula and birth work. I'm sure that there are a number of other organizations that are training, but of course, as we're talking about choice, I wanted to make sure that I uplifted the organization that I'm currently going through.
Thank you, Anna. And Cynthia, did you want to share anything on the West Coast?
Yeah, I would love to just add it to the document that's being shared out.
Okay.
I do want to add something really quick. I know that one of the questions you all had for us was how can public health and medical professionals improve Black and Latina maternal health outcomes by incorporating environmental justice into their practice? And, I put some thought into this because my experience, working with providers and actually a survey that UCSF Bixby came out with, and I'll provide that link as well, is that they asked a group of providers, like, what do you ask people during their appointments? There was a huge emphasis on smoking, weight gain, alcohol use, of course, like high levels of mercury because of fish. But they noticed that things like pesticides, air pollution, processed canned foods, cosmetics, and fumes from gas or the environment were not asked. And often these providers, their reasoning or their excuse was like, well, I don't feel informed enough, or I don't know this enough, so I'm not even gonna ask. And so one of my things is, how do we continue pushing people to ask things about exposure to air pollution beyond smoking, exposure to pesticides? We've talked about lead, and one of the things that I recently heard from someone I worked with was, she lives in San Francisco, one of the most, and I said this in the last gathering, one of the most expensive gentrified cities in our country. And she shared with me, she's like, I have mold in my home. And I am scared that if I say something about the conditions that I live in, child welfare services will be called on me. I'm also a brown woman. I'm also a woman that English is not my native language. It is a language that I am still learning. And so as we talk about these different environmental factors and like who gets blamed and who gets considered an inadequate parent, how that intersects with child welfare systems, and how if someone reveals this information to their provider, their care team, how will they then get funneled in the system that is not made for them as well?
So I'm hearing you talk, Cynthia, and it's so problematic that on the flip side of things, this is also an issue. So on the environmental side of things, the public health considerations and what these individual families are having to consider aren't usually even mentioned, even though these are all related to people. All of these issues, all of these living conditions and realities are relating back to people. And I'm kind of thinking like in a future where we do have legislation that's focusing on those people, specifically Black and Indigenous people, including Black and Indigenous people in the Latinx community. Side note there, I don't like to say Black and Latinx because that creates an invalid bifurcation in my opinion. You can be Black and Indigenous and Latinx, and there are also white people in the Latinx community. So anyways, yeah, the folks who are most impacted can be centered by this legislation, and everyone that is involved in providing services tied to someone's health is required to have a holistic perspective of what on the ground the person is facing and what are the issues that they're facing, including what is contaminating them and making them sick, and how this is disproportionate and why, whether there's lobbying efforts, for examples, that is allowing like corporations to just disproportionately cite facilities that are causing disproportionate rates of asthma, for example, in specific Black and Indigenous communities. Like, these are just ways of thinking that, once again, there's this illusion of justice, there's this illusion of access to a clean, healthy environment that these communities, our communities, just, that's not our reality. And I really do think that it has a lot to do with the fact that all of these different bodies are purposely separated and purposely do not work together, even though they should.
Well, I couldn't think of a better final thought to leave us with. We are at 7:01. It is the end of the evening for us. I'm so grateful for all of our panelists. And I want to give a shout out to everybody from Ancient Song Doula Services who has been engaging. I'm also trained with Ancient Song Doula Services. You guys have been amazing engaging in the chat. For all of our panelists, please put your social media or website information out so that folks can follow you and see what you're up to. If there were any last minute questions that did not get answered, please feel free to throw them in the chat right now so we can answer them in our FAQs document. And I just want to thank everyone for engaging with us today. We will hope to see you next time, because I think there should be a next time. And thank you all. Anything last but not least, Latricia, I'll let you close it out.
I was typing so swiftly. Make sure attendees, as you are transitioning out, if you would take the survey. I promise it's really short. We really value the voices of our attendees, especially the voices of Black and Brown women. So make sure you complete that, and then also follow us on all of our social media outlets. In addition to having a very robust programmatic calendar, like real talk, we also drop gems about environmental justice issues. We share a lot around legislation at the federal level, at the state level, in the areas that we touch. So just engage with us on Facebook and IG. I will put the handle for IG and Twitter in the FAQ and in the chat box. All right. Look at all these people sticking around with us. This is beautiful. Thank you all so, so much.
Thank you for having me. I'm very honored to be a part of this conversation, and such wonderful, beautiful folks on the call today.
Yes, Anna, and make sure.
Thank you.
At all times. Like I said, my name is Latricia Denise, not Denise, Denise Adams, and I will get people together at all times. So absolutely. Thank y'all.
Thank you.
Thank you, everyone, and thank you to the co-panelists. Bye.